How's it going, everyone? Hope you're having a great day. Welcome to a video on Pilates classes or attending Pilates classes when you've got hip pain. Okay, so when I say hip pain, I'm only really discussing sort of the two most common sort of types of hip pain we tend to see in the general population. So one of those being GTPS or lateral hip pain or gluteal tendinopathy, whatever you want to call it. Pain on the outside of the hip, more soft tissue in nature, okay? And I'm going to talk about sort of osteoarthritis or OA hips, and sort of I'm going to lump sort of fibroacetabular impingement or FAI, hip impingement, again, whatever you want to call it, in with that as well, because they tend to have the same aggravating factors, okay? So I want to talk a bit about sort of moves in Pilates that are more likely to sort of annoy these type of conditions, when it might be useful to kind of just have a little push and just go, actually, maybe this is okay and I can challenge myself a little bit, and when to kind of go, actually, you know, I'm not pushing that, like, because I'm not going to be able to work through it. It's just not going to happen for me, okay? We can talk about some modifications that I get people to do in class. So I've had Pilates seems to, a lot of people tend to gravitate to Pilates when they get injured, okay? I see a lot of people with low back pain, a lot of people with hip pain, so lateral hip pain or OA hips or impingement or anything like that, and they think, yeah, I'm going to get my core really strong. Firstly, I just want to point out that Pilates is probably not going to solve all of your problems, okay? But it is an effective way to exercise, really low impact, very minimal equipment, and actually challenge some of the muscles around your body. You're not going to injure yourself irreparably off that unless you're doing something really, really, really silly, okay? So a lot of people gravitate towards it, but I would generally tend to combine that with a few other things, lifestyle modifications, all of that sort of stuff, but that's for a separate video, okay? So when you kind of walk into classes, it's very rare that you're going to find a class that is just specific for hip pain. If you have, then it's probably run by, you know, the NHS or a local private hospital or a physio with like loads of interest in hip pain, for example. They're pretty hard to come by. And then, you know, especially locally, and generally, if you've got hip pain or one of these conditions, they can last a long time, okay? Some things, you know, you're going to be living with more than anything else. So if you can't get into regular classes or anything like that, or you're worried about going to regular classes because you think, actually, what if I hurt my hip? It secludes you quite a lot from being able to do some of the things that you might want to be able to do, okay? So actually learning a bit more about, okay, well, I know I can't do this movement, so I can modify it this way, and then going into that class with a very good set of, I'm not going to do this type of movement, but I can do this sort of stuff. It makes it a lot less of a fearful experience, more confident to go in, and then also more confident not to just go with what everyone else is doing, because as much as people say Pilates and yoga and things like that aren't competitive, when you get into that room and you see the person next to you that you don't know has been there for like 20 years, sometimes it gets a little bit more competitive and you push yourself past where you're probably happy to go, okay? Obviously, if you're following all my courses online from the comfort of your own home, then you can obviously just pick and choose some of the stuff out of the videos, but I ideally want to be able to make this so you feel more confident going into like the mixed ability classes that I've put up, because there are loads up there now, and if you can go into those classes and think, actually, you know what, no, I'm not going to do that exercise, I'm not going to do this, I'm just going to do this stuff instead, that's great. Yeah, it's going to work for everyone, instead of finding something that's really, really specific just for hip pain, because we're all different. And everyone, you know, there's loads of people with osteoarthritis in their hips, but I know some people that can do a lot and some people that can't quite do as much, and that differs greatly, not just on how advanced the OA is either, okay? So we're all different. Generally, you also need to look at sort of accumulative load management as well. So it's not just one specific move or things like that as well. If you find that you're doing an hour class and your hip's kicking off, okay, just be aware that it might not be one single thing that you've done. So try not to overanalyze it. It might just be the accumulative stress of how much you've done too much too soon, okay? Just kind of keep that in the back of your mind. All right. So what we're going to do is we're going to go through some of the basic positions in Pilates, okay, and how they might be influenced by hip pain. And then we'll go through some modifications for them as we go, basically. Okay, so we're going to start with osteoarthritis and impingement. I'll put a little timer up to kind of skip to the GTPS section if you're watching this just for the GTPS or lateral hip pain section. Okay, so osteoarthritis, FAI, if you've looked at the other kind of information videos that I've put up on these type of things, you tend to categorize that as a loss of range of movement or a loss of rotation in the hip. So actually sitting like this might not be very comfortable, okay? Some people can sit like that, but you might find the knees kind of up in the air a little bit, you're losing that rotational capacity. Hip impingements, a lot of the time, prefer to be in this position because it's kind of a bit more open for the hip, whereas they hate being into this other position, so rotated into there, okay? So just to show that kind of from a side lying perspective, anything that's taking the knee towards the chest, you're going to limit that kind of flexion. You probably might not have that much range, and anything that's kind of challenging this internal rotation, so where your foot's going out to the side, okay? Now, that sucks a bit because a lot of the Pilates is kind of 90 degrees at the hips or just a bit beyond, okay? And then you're spending a lot of time here. So if you can't get 90 degrees comfortably, you've only got a few options really available to you, okay? Because holding this here long term, especially when you're doing the other sort of leg as well, it's really hard to keep your back flat. It's probably not going to be achievable. So we need to try and find a position that's a little bit easier. So you can play around with how far out to the side your leg goes. So if I show you that from the other angle as well. So when you're here, you might find here being really uncomfortable. You might find here actually much more comfortable. So you could actually work with your leg just slightly rotated if you need to, and then over time you can see about potentially bringing that hip in, okay? It's an option, certainly. It allows you to move, you know, without a lot of pain, have a little play around with it, okay? So those positions and this position you see in a lot of different kind of positions in Pilates. So you might find that when we do squats in the warm-up, for example, or we twist and move side to side, this level of rotation just is not for you, okay? In which case, make it minimal, okay? And just start there and just get into that sort of position and work within the range that you've got. Don't push it past. If you're getting solid groin pain, solid block, that's not something to push into. You can't push through that, okay? And the same goes when we do like a hip flexion stretch at the start, so when we're coming through into this position. If you're getting solid groin pain, this isn't something you're going to be able to push into. If you're getting a bit of a stretch kind of around your hip, but you know you've got OA and you're like, oh, I don't know whether I can push this. If it's just like a muscle stretch, that's okay. And sometimes you won't know without kind of actually a bit of trial and error effectively, okay? Because it's okay to sort of stretch an arthritic joint to a degree, just don't push into solid blocks that are really painful, all right? So if you can't get your hands down to the mat to do this, you've got a couple of options in this position. You can take your knee out to the side again, okay? Notice the trend. We're trying to avoid kind of taking the knee right into the chest. Take it out to the side. That might give you a little bit of breathing space, or you use your trusty block, okay? And you can have a block there so you don't need to bend anywhere near as far forwards, all right? Some people might find this is just not acceptable to them, in which case you could do like a hip flexor stretch or something like that, and you just work within what you've got. So even just doing stuff like that to begin with is absolutely fine, okay? Moving on, child's poses are something that you will see in kind of Pilates quite a lot, okay? So this type of position, again, you'll tend to see a traditional child's pose would be the knees together. You might find that you can take the knees apart, gives the hips a bit more space, okay? If you can achieve that, fantastic. If you can't, take it out completely and just do like a dolphin's pose. So now you're at 90 degrees at the hips, and it's much easier to kind of hang out there, and that's okay to do this, all right? Especially if you know that you're not going to overload your hip too much. Generally, the side-lying positions with an OA hip or an FAI hip are pretty easy, okay? Because you're not really kind of challenging that range of movement too much, all right? And we've already discussed the ones when you're lying on your back. So they're generally the main things that we want to avoid. Knee to chest kind of movements. If it's all about knee to chest, take it out to the side a little bit. You might find you give yourself a little bit more room. But it's a bit of trial and error, just trying to work out what works for you. Where I was sitting at the start, sitting on the floor can be very difficult. So using blocks or anything like that for seated movements can be much easier. You can get much thicker blocks or multiple blocks to stack up, and generally that would tend to take the pressure off the hip and sometimes the knee and the lower back, so you can kind of work through some stuff like that. One of the stretches I do very regularly is like a side bend. So we get into this type of position, twist towards the bent knee and reach up and over. Now, some people's hip is not going to allow them to do that, okay? But you could potentially just be here, and that actually works quite well. And you can twist, because the stretch isn't for this hip, it's for the kind of side and for the hamstring. So working through there, just adjust your hip position a little bit, so you're giving yourself space in the hip joint, okay? I hope that makes sense. There are obviously going to be plenty of other examples, but they're generally the ones that I tend to see first off, okay? Just coming back to the one lying on your back, just work out as well, when you're here, Try and work out if it's like a solid groin block that's stopping you from being in this position, or it's just those muscles are so weak, okay, that they can't quite keep you there. So actually, if you take the pressure off and you just hold the leg with your hand and you just let your leg relax, does all your pain go away, okay? In which case you might find that it's not necessarily the joints that's doing that and it's the muscles around it, in which case that's okay to just have a little go and just see if you can strengthen it and see if you get used to that position. You do the same thing by coming out to the side a little bit if you need to, okay? Any form of like twisty type stuff, okay, so like hip twist, stuff like that, where you're taking your legs across the side, even when your legs are on the floor, all of that like rotation, it's fine normally when you're opening that leg out, but this one is then coming in and then really kind of winding that hip up a little bit. Again, you can use your trusty block. So you might be able to do it while doing that, just to keep your legs together so it's not pushing your knees and knocking them in, okay? Or you can avoid it and you just work at a different exercise, that's fine, okay? I do another one as well where you're kind of working through like full rotation of your hip, and you might just find that you just don't push that range anywhere near as much, okay? So you're just doing a little bit at a time and not pushing into like horrible groin pain and hip pain, all right? So that's OA and FAI. Obviously, like I said, there are going to be loads of other examples, but generally that's why you go to face-to-face classes or see a physio if there's a specific problem that you're having. Obviously, you can contact me in the forums or through Facebook or anything like that if need be, if you had a specific question, okay? So moving on to GTPS or lateral hip pain. Pain on the outside of the hip. So there are a few different things that can irritate this, probably more so than OA. Normally with the OA, people are kind of like quite happy with how far to push their hip and not, and when not to. With the tendinopathy type pain, people tend to go at it and they sometimes think that they're doing a good job, but overloading it at the same time. So just remember that with this kind of tendinopathy, okay, we're all about trying to manage load, and that load comes in form of like challenging the leg, but also compressive load of stretching that tendon and pulling it down and sort of compressing it against the bone. So we need to manage load, and we need to manage that accumulative load, so making sure that we're not doing too much too soon. If you've got this type of problem, I highly recommend that you seek some form of graded strengthening exercise for it, as long as it's not too acute. And if it's that acute, you're probably seeking some form of help somewhere, okay? Some of the side-lying stuff that we do in Pilates classes, it can really irritate the side of the hip. Some of it you'll see as part of your rehab. You might already be doing some of those exercises as part of your rehab anyway. You just need to make sure that you're doing the right reps and sets for you. So if I'm there doing loads and your hip's absolutely knackered, you need to do a little bit less, and it's okay to do less, okay? That's harder to make yourself do that in a class because you kind of want to do what the next person's doing, or the other person in front of you might be 20 years older and you're like, how are they absolutely like caning this and I'm struggling to do it 10 times? You've got to do what's right for you, okay? And with the online videos, that's a little bit easier to do, obviously. But just be mindful of how much you've done within the class as well. So not just the one specific movement, but how much you've done. So if we talk about moves that are really kind of going to load the outside of our hip a lot, anything with a single leg balance is going to load the outside quite a bit, okay? So you might need to rest regularly when you're doing that stuff. I regularly give a single leg balance, trying not to like dip and kind of hip hinge and all that sort of stuff as part of my rehab for this type of problem, okay? It's just about the dosage that you're doing it. So any of the stuff at the start, if you're struggling with that, again, just make sure you moderate what you do. Again, in the warm-up, anything like sort of squats or kind of coming side to side, things like that, anything that's going to challenge that single leg. Again, if it doesn't hurt, that's okay, but just monitor what you do. Make sure you're not doing too much too soon. Monitor what your pain's like sort of 24 to 48 hours after you've done the class. And if it feels fine, then it's going to be okay. If it feels really sore and achy, chances are you might have overloaded it a little bit, unless it's just a bit sore and achy from general exercise, okay? So any single leg balance stuff, just be mindful of what you're doing. So the other stuff that will tend to load those tendons up quite a bit are all the side-lying things, okay? So firstly, you can get some compressive load when you're lying on your sides. If you're lying on your painful hip, a lot of people don't like doing that, okay? In which case, you might need to fold your mat in half or get yourself a really nice foamy cushion or something where you can actually roll onto it a little bit easier, or just roll slightly forwards a little bit when you're doing the other side, okay? Now, when you think about your painful leg being on the top leg, now you might see like leg lifts in a Pilates class. You might even see the dreaded clam exercise, okay? So a lot of sort of thoughts been going into like banning the clam from this type of problem, and effectively it's because sometimes it's pushing you again into that internally rotated position, okay? If you're someone that has no hip pain at all, one, I'd question why you're watching this video, but also, you know, it's not going to be a painful exercise. It'll be okay. You get a bit of a burn in the tendon, all right? But you might find that actually skipping the clam is useful for you if you're rehabbing from a lateral hip pain, all right? So you could just do the leg lifts, that's fine, okay? And working through there, again, working through good technique. I talk about all the good technique in the Pilates basics video, so you can go have a look at that, that's fine. But again, we're monitoring how much load we're doing, okay? How much time under tension, how much are you challenging this tendon, okay? And we just want to make sure that you're not overloading again. So if you need to take a break, okay? And then go from there. The other things that tend to add compressive load are any sort of stretches for the muscles on the outside of the hip. So you probably would have all seen this sort of stretch before, yeah? Some people have even been given it, I'm sure, for like the lateral hip pain and stuff. Generally, when you wind someone up into this type of position, you're going to put quite a lot of compressive force through that tendon. And for some people, it'll feel lovely short term, but then actually probably not do them any good in the long term. For others, it will just hurt straight away, okay? If you're pain-free or like towards the end of pain-free and you want to develop this flexibility, obviously you're going to have to challenge this a little bit, okay? And poke the bear a bit. And again, if you're only getting a bit of a stretch while you're doing it, it's not kicking things off in your hip or anything like that, then generally that's going to be okay. But always seek guidance if you're concerned, all right? So any stretches like that, that's the same with like a pigeon pose, for example. If you've done a pigeon, again, they're the same sort of things. So ending up in this position, putting a big stretch on, okay? Or ending up in a cross-legged position. Again, it's all the same. It's going to put a bit of stretch through the hip, which isn't necessarily bad, but it is if you've got a really acute hip that's easy to annoy, okay? So generally, they're the main things that we tend to look at with sort of the lateral hip pain, and we want to modify them as such. So if you are, the majority of the loading ones, you're modifying by just doing less, okay, and taking a break if you need to. The stretchy ones, so again, you could sit on a block if you'd like. You can completely avoid this type of position if you need to, and just move into that type of position, provided your hamstrings have the ability to do so, okay, whenever you're doing these stretches, or you just avoid those type of stretches, okay. And when you're doing the figure 4 stuff, you might find that you don't want to do that stretch, and actually you just dial back the rotation a bit, just hug the knee into the chest a little bit, or just draw some sort of light circles to kind of keep things moving, okay? You're not missing out much on a static stretch or anything like that. So it will be fine just to work through things and do that instead. Pigeon, generally, if you are doing that type of pigeon pose, or you want to change it up a little bit, instead of winding, if I show you from the other side, instead of winding your hip up like that and having your foot quite far forwards, you could take the pressure off quite a lot, okay? You'll probably get rid of the stretch if you do that, but if you kind of want to be in a class and look like you're doing what everyone else is doing, this would be it. It's probably not going to put a lot of stress through the side much at all. Or you just adapt and work a bit more on your hip flexion instead, and you just take a leg up and work that. Just let the teacher know that's what you're going to be doing, okay? So they're the common things that I would generally tend to change or get people to watch out for. Obviously, everyone's a little bit different, okay? Some people might be coming with sort of, what other hip pains have we had? Sort of psoas releases, multiple surgeries. Everyone's going to be different. We need to adapt things accordingly, okay? But there's some of the common adaptations that I generally tend to get people to do, so they're not overloading things as they go through. All right. I hope that's been useful. Obviously, if you're not sure, go and chat to someone about it. Book an appointment. Go, actually, you know what, and analyze the class that you've gone to and gone, actually, yeah, I've done these movements and these ones were absolutely fine, and these ones, well, they could have irritated it. Talk through it with the healthcare practitioner and sort of come up with ways that you can do things different, because there are generally always a workaround. There's always something else that you can do, okay? And it's important to keep exercising if possible. All right. Hope that's been useful. Enjoy the rest of your day. Keep moving, and I'll see you soon.